This is a demonstration of lung tissue showing a Candida-like fungal infection or pneumonia. And you can see the organisms in the alveolar spaces there. It mixed with some colonized bacteria, but the organisms are actually present within acute inflammatory response and histiocytic cells. And I'm going to scan around on a lower power view so that you can kind of get a gestalt as to appreciation for the pneumonia and the organism. So I'm just going to scan around. You can see that for the most part the lungs don't look as bad, but there is definitely a pneumonia, as I will convince you, if not on this slide, on the next slide. But you can see the polys in the in some of the alveolar spaces and in the interstitium, but it's not as obvious on this slide, so I may have to go to another slide. But you can see some colonized bacteria there and the yeast. So more than likely the yeast perhaps came from the oral cavity, perhaps through aspiration pneumonia. And you can see some foamy histiocytes as well in some of the alveolar spaces. But I want to keep on going around until I get a better view of the inflammatory response. And it may not be on this particular image here as I keep scanning around. You see more yeast elements, Candida-like fungal elements there. And yeah, this is definitely probably colonized from the mouth that eventually was aspirated into the lung. So maybe it started out as a thrush, oral thrush, and then developed a pneumonia. But let me go to a different slide that will show more of the inflammatory process. As you see here, most of the lungs, the alveolar spaces themselves don't look as bad, but there's other areas that show obviously more inflammation than what we have here. As I continue to scan around on this particular section here. So let me just go now to another slide. So on this image, you can see this is another slide showing clearly inflammatory cells within the alveolar spaces. I'm just going to stay on the low power so you can see more of the inflammation, and then we'll go down. But this obviously was an early infection. As you can see, it's not rib-roaring acute inflammation. In some areas there is more inflammation than others. But this is the, let me just go around faster. That way we'll see more inflammatory reaction within this lung sample. There's a little more information there, and we'll go down even closer. But you can see there's a few giant cells here. If I can keep going around, there's one there in the center, multinucleated giant cell. So this is definitely an inflammatory reaction to those yeast-like elements that I showed earlier. And again, we will go down just to show you a closer up view of some of this inflammatory process. Like here's a good area right here to look at. So we're going to go down even closer as I bring it into focus. There are some foamy histiocytes in this infiltrate as well. And as I continue to scan around, we're going to see more of the acute response. Okay, there are some neutrophils there within the alveolar spaces. Those are foamy histiocytes there. So we're going to keep on going around. It's kind of difficult to show, you know, on these random sections here. But when you see it under the microscope, it's a little more obvious to see what this stuff here. Okay, you can see more, surely, acute inflammatory cells in alveolar spaces there. And there's a multinucleated cell there. But you can see the polys as well within the alveolar spaces. A little more foamy histiocytes than I would like to see, so there may have been a... No, this is all a part of the inflammatory process, and there are some multinucleated cells there, and even there too. And alrighty.